Okay, so welcome everybody, and thank you for joining us today. Thanks also to the people who've waited patiently for this event to be rearranged from the 10th of June. Really luckily, all of the speakers are here today, so it is the same event, which is great. My name is Caroline, and I'm employed at the University Hospital Southampton, and I have quite a few roles there, but they all relate to patient and public involvement in research, or PPI, as you'll probably hear the acronym today. And one of my roles there is co-leading the Wessex Public Involvement Network, who have organised today's event for us. And it would also not be possible without the generous donation of time from Sally and all of the speakers, so a huge thank you to them. Today we're going to be talking about techniques, strategies, ideas for how we reach out to and involve new members of the public in the current virtual world, in particular those who face additional barriers to involvement and participation, or may not always be heard or listened to very well. So hopefully you've all received a copy of the agenda, but the Wessex PIN admin team, Mike and Catherine, will post it in the chat for us again now, for those who haven't. It's quite a fast-paced agenda, and we aren't going to be able to provide all the answers to all the topics, but hopefully we'll stimulate some thinking and ideas generation, which we can kind of follow up in future conversations. So I'm going to hand straight over to our first speaker, Josephine. And one of her roles is as the Diversity and Inclusion Lead for the NIHR Applied Research Collaboration South London. And she has written two very powerful pieces in the BMJ, which may already be in the chat. I'm not sure because I can't see it at the moment, but they'll be posted if not. So thank you very much for joining us, and we'll hand over to you.
Thanks very much, Caroline, and I'm so delighted to be here with you. And I just can't think of there being a better time to have this discussion than doing it now. If we're not going to make some of the changes that we need to make now, I wonder when we'll ever do it. So I'm just going to see if I can share my screen, which I think is that one. And this is the paper that I wrote for the BMJ. And of course, you know, being heard, not seldom heard, it just kind of feels like it's kind of so ridiculous that, you know, in this climate, we have to keep talking about seldom heard groups. And I think this whole paper was an attempt to kind of shift the focus away from being on the groups and communities that are excluded to looking at the structures that are excluding them. So I just want to go through some of the key points from the paper. And I guess my starting point is that I just feel that we need to open up a broader debate about democratizing the whole research process rather than just talking about diversity and inclusion in PPI.
Sorry, Josephine, sorry, can you just full screen your PowerPoint for us? It's not coming through on full screen.
Full screen, that would be the slide. Yeah, is that okay?
Yeah, that's better, thank you.
Yeah, and so that point about opening up that broader debate and democratizing the whole research process, I think is just so important. And one of the things that I wanted to draw upon in the paper was in relation to some of the debates that are taking place in global health research. And they talk about moving away from some of these traditional top-down approaches, which they talk, you know, they refer to as semi-colonial approaches, which they've argued serve the interests of populations in high-income countries. And they've talked about the need to have more equitable research partnerships addressing high mortality and morbidity rates in poor and middle-income countries. And I really seized upon some of those debates to apply that thinking in the context of the UK. I think those debates raise real questions about democratising research, particularly in the pandemic in the UK, and questions about who benefits from the research process and how it addresses the needs of groups facing some of the worst health inequalities. So we're probably all familiar with some of these statistics around the groups who've been most affected by COVID-19. You know, we've seen some really stark disparities in mortality rates for BAME groups, people with disabilities, those on lower incomes, those living in the most deprived areas, care home residents, those in the poorest health, etc. And these groups already face considerable inequalities in health. And yet the irony is that these are the groups who are least likely to be involved in research design and implementation. And this reflects wider patterns of public sector involvement, which show that those most likely to be involved are older, from white ethnic groups and higher socio-economic backgrounds. And so this context, you know, exists despite long-standing calls for more equal partnership models to involve diverse groups in research and healthcare practice. So we've known about some of these issues for a long time, and we haven't addressed them. And so what was important about our Zoom event is that we actually had it at very short notice. And so we were kind of debunking the myth that you couldn't reach diverse communities. We were, you know, we were sort of, in terms of registration, you know, we were kind of up to capacity within 48 hours. And what we were hearing about was issues that you often don't hear in the room when you're talking, when you know, when you have patient and public involvement. We had BAME women who are 5 times more likely to die in childbirth than white women talking about racism. And, you know, in the context of Black Lives Matters, of course, we need to talk about racism, and yet that often doesn't happen. We heard from BAME groups who were not attending outpatients appointments, like many other people, because of fears of getting coronavirus. But this was already in the context of high levels of distrust in some parts of the BAME community about health systems. So this kind of, you know, raises the danger of compounding inequalities. We heard from people with disabilities, learning difficulties, who were talking about discrimination, issues that we're not often talking about in PPI, and they were talking about, you know, whether they would be treated fairly in terms of access to resources and ventilators. We heard about digital exclusions. And again, this is going to be really important. Those people who can't access, who can't get access, and we can't reach, because if we just do everything via the digital world. And then we heard from lots of people who were really suffering because of loss of face-to-face services. So I think one of the key things about the Zoom event was that we were talking to groups from across the protected characteristics, groups that we often don't hear from, who are raising issues about their needs that are often not being picked up. So broadly speaking, we've taken a number of recommendations to the ARC South London, because what we're really saying is, let's look at D&I in a broader sense, so that we can kind of democratize some of our structures. And some of the recommendations we're making are that D&I becomes a standing item on all our boards and committees, that we add diversity and inclusion to the terms of reference of boards and committees. We explore how broader community representation of individuals and groups can be achieved on ARC boards and committees. We want all projects considering D&I. We want people to keep D&I achievement logs to identify both good practice, areas of improvement, and also to monitor progress. We want further thought to be given to addressing issues of underrepresentation of research participants in research themes, especially from BAME, disability and LGBTQ+ groups. And we want to explore how staff from underrepresented groups are able to input at a strategic level into the work of the ARC. And so when we're talking about diversity and inclusion and looking at D&I in the context of PPI, we think it's important to be holistic and to address the fact that people from diverse communities are also underrepresented in the academic and research process. And I'll leave it there. Thank you.
Thank you very much, Josephine. And if people have questions, please do put them into the chat. because there'll be time in the panel at the end to go over them. So what we're going to do now is move into the next section, which is around making sure our events are inclusive and accessible to our audiences. So I first want to just sort of look at how inclusive and accessible the audience members here today think that our events are. So I'm going to launch a few poll questions. So the first question is, have you seen new people taking part in your activities who hadn't previously? And by previously, I mean, have we seen new people in our online events that we didn't see when we were doing face-to-face things kind of in the COVID times? So I'll just give you some time to all vote. One example for us is that we've seen a lot more people from those who work full-time, because everybody has been kind of home-based for a lot of lockdown. They've had more flexibility over their own schedules, and so we've seen a lot of people who typically worked full-time and weren't able to attend our meetings come through. So I'll give you about 10 more seconds and then I'll finish this one. So, right, I'm going to end it. Sorry for those who might not have had time to vote. I also forgot to read out the answers, which I was meant to do, so I'll do that for the next question. But I'll just share the results with you. So you can see 43% of people today have seen new audiences versus 18% who haven't. So that's quite positive, I think. But if we just move on to the next question, this is possibly slightly more of a negative one. So are you aware of people who you worked with before, kind of before the lockdown, who have since been excluded or self-excluded from your virtual activities? So I've got quite a lot of votes coming through and there's a lot of yeses. The first is yes, the second answer is I think so, the third is I don't think so, the fourth is no, and the final one is not applicable. So I'll just give a little bit more time. I've had about 70% of people voting. If you're coming in on on Chrome or on Mozilla, or you don't have the app, it might not let you see the polls. I think it depends a little bit on what browser you're using. So I'm going to end this poll. I've got about 80% voted. Feel free to put your answers in the chat if you can't see the polls. So 44% of people are saying that they have seen people either be excluded or self-excluded, which is obviously very high and something that oh, sorry, I haven't clicked the share button. There we go, you can see it now, hopefully. So that's really interesting, I think, and also slightly worrying and something we need to address. So I think I just have 2 more quick questions for this to understand how everyone is. So what were the causes of those people that were self-excluding? And you can click as many of these as you feel are appropriate. So the first is around no or inconsistent internet access. The second is that they don't have the technology. Third is that it wasn't working. Fourth is to do with their kind of digital literacy, we call it, which basically relates to how they use technology and their confidence in it. The fifth is about not being confident to engage this way. Sixth is that they don't want to. Seventh is accessibility issues. And then we've got an other and a not applicable. So I'll just give a couple more seconds for people to cast their votes. So two or 3 more seconds I'll go for. Right. Here we go. So if you're saying other for any of these, please do share those reasons in the chat. So we've got a real mix here, I think, of causes, which I think is very interesting. Some of them are easier to address than others. A lot of people not knowing how to use the technology. Also a lot of people without the internet, or they just don't want to take part. One of our examples of other is that there were some people today who, when they found out it was on Zoom, they chose that they didn't actually want to take part because they felt that Zoom had security issues. So that's another example of a challenge or an issue. And then the fourth question relates kind of specifically to inclusion and access. So this is around what access issues or challenges have you seen? So this question might not be applicable to some of you who haven't seen this as an example, but okay, I'm going to end this one. So again, here are the results. If I've missed things, so for the other, please put them in the chat. The highest one here was audio as an access issue or challenge, but you can see there's quite high percentages across all of these. So that's something that we're going to hopefully discuss in a little bit more detail now. So what I might do is just ask Julian, Josephine and Sophia for a minute, if you don't mind switching your cameras off, just to make the people chatting slightly bigger for this session. Thank you. So we've got Anna, who works in the public programmes team. Sorry, public programmes is a partnership between Manchester University NHS Trust and the University of Manchester. I'm sure that Bella can help me input a link in the chat for me. And she's going to talk a little bit about her own experiences. Louca-Mai runs an young person's advisory group at Moorfields Eye Hospital. And Tess is a public member who works with the NetCC, which again, hopefully someone can define that acronym in the chat because it's too big for me to know. And then the Wessex Public Involvement Network, who are running this event, and she's an advocate for disabled people. And then I've got a specific question for each of them, and then we're going to go to Sally in the chat to find out a bit about the audience members' kind of questions and some of the poll responses that might be going on. So I will start with Anna. Thank you for joining us. Could you please tell everyone a little bit about yourself and your experiences of having to work and adapt to this virtual COVID world?
Hi, thank you very much. So I've been working in health research for a long time, and this is really the first time that I've used technology, and it's definitely had some challenges, but strangely it's also opened up a lot of opportunities for me. This is the first time I've used Professional Otter, and it's amazing. So as a person who is deaf, subtitles are crucial for me. I only hear a maximum of 50%. So if I don't have subtitles and visuals, I can't participate at all. This has been a challenge. I did ask for Otter, both through my team and through access to work right at the start, and accessing technology, even in the context that I'm in, it hasn't been made available to me. But I have managed to overcome that by using my own technology. So I bought speakers, and I use my phone. I bought a split track and some speakers, and I have to put my phone up against the speakers and use Google Live Transcribe, which is free, and use the video as well, which is great. A little bit tiring clicking through. On the other hand, with that now in place, there's been a huge benefit to me, and I'm able to participate in ways I couldn't before, because online everybody faces forward, so I can see lip patterns and people speak one at a time, so there's no over talking. And interestingly, I find it much less, people stick to the point, and there's much less of an emotional experience, which, although, you know, is sad, it also makes the whole thing less complicated, because deaf people are constantly trying to glean information from all our other senses, and we often take on emotions too much. So actually having a screen stops me really thinking and enables me to focus. So that's been actually a surprisingly wonderful experience, and the available of free technology for subtitles has been amazing.
Thank you. That was really, really interesting. So thank you. And I'm sure there might be questions for you coming forward in a minute. So Louca-Mai, I know that you've had a meeting of your young persons group actually in the last couple of days. So can you tell us a little bit about the sort of adjustments you've had to make for this group, who I don't think I mentioned, a lot of them have had kind of eye treatments or eye challenges?
Yeah, sure. So I support a group based at Moorfields Eye Hospital, and it's a young person's advisory group. It's part of the Generation R network of young people's advisory groups who work with the National Institute of Health Research. And this particular group is focused on supporting young people's involvement in eye and vision research. And so we have young people aged between 10 and 17. And some of them, about half of them, have visual impairments. We also have a couple of group members who have other access issues, including hearing impairments. So I've put in the chat a link to a blog. So we've now had 2 meetings of the group on Zoom. We used to meet face to face every few months, and I'll just very briefly share. I put it in the chat as well, and I'll share it on Twitter. But this is a blog that was written by Orla, one of the young group members, about the first meeting we had in May. About what we did in the meeting, and I won't go through it all now, but just to kind of highlight. So what we do is basically with every meeting that we do, we get one of the young people to write a blog about what we did in the meeting. And I think there's a couple of kind of key learning points, really. I mean, I think as you know, Josephine and others have mentioned, I think there's an interesting tension for me in doing involvement on Zoom. In some ways, it's not as accessible for some people, but in others, it's more accessible than perhaps some face-to-face meetings can be. And I know a lot of the discussions that have been had, I'll also share a link. John O'Broad, who's here today, and I are also involved in a series of meetings on co-production and involvement during COVID. And I think there's quite a lot of people who said that actually for some people coming to Zoom meetings is easier. And for the young people's group, we've been able to have we have shorter meetings every month instead of doing one every 2 or 3 months. But I think it has been challenging. And one of the things I've mentioned is I think we found that polls are really, really good for some of the young people, but are really not that accessible for others because the text can be so small. And we had, I think, the last meeting we had just this Saturday gone, we had one of the young people coming who hadn't come to the first meeting, who had hearing impairment as well as a visual impairment. And actually that was, so we used Otter as we're using today. And with that, because we were just trying it out, we use the free version, but you can just put a new link in. That kind of runs out after 40 minutes. It just gave a new link every 40 minutes. But I find one of the things that really helps, I think particularly with a range of young people, is the chat function is really helpful, so that some people can, feel comfortable talking in the group. Other people will be much happier with the chat. And also we do quite a lot of stuff in the breakout groups, which I think is one of the reasons I think I found Zoom really helpful, because I think the breakout groups make it easier for everybody to have a chance to talk. But I think really the big thing for me is that we've gone into it because we're trying to run this group according to co-production principles, which, has its challenges, obviously, with kind of such a range of ages. But I think one of the things we found with working with the group is that, we're kind of learning together. I'm not going in as an expert on doing online involvement because, my learning curve's been pretty steep, as a lot of people's have. So I think it's very much, we're making sure that we have a dialogue, and we say that, we're learning about how to do this as much as you are, and trying things like interactive whiteboards, and also things like Google Jam boards, and the kind of things like that where you can brainstorm ideas online, and just having constant conversations with the young people about what works and what could be better. So I mean, I think it's a learning process, but I think we'd like to do more of that. And I think there's I can see there's a couple of people in the chat who've put in links. There's a lot of the other Generation R young people's groups are also trying online meetings as well. So I think the main thing that I would say is I think it is partly about access needs, but also I think one of the other things is to be aware. A lot of conversations about public involvement and engagement tend to sort of take adults as a norm, and actually there are different considerations about involving children and young people, and it's important not to forget that, not least having to think about things like safeguarding. So we had to do a lot of safeguarding and risk assessments and things like that to be able to run a Zoom meeting with young people online. So I think to kind of bear in mind that there are some things you need to do differently with young people, but also not to forget in the conversations we're having about, the range of groups we're involving in underrepresented groups, that children and young people in themselves are a significantly underrepresented group in a lot of public involvement work.
Thank you, Louca-Mai. And finally, Tess, as a public member, do you have anything that you would like to bring up around this kind of issue of accessibility and inclusion?
Hello.
Hello.
I thought, wow, listening to those guys, I'm not quite sure how to follow on. I think there's about 3 points I want to make if I can make sense of my notes. I think the first one is that the excluding structures that existed before actually still exist now. We're just kind of using a different vehicle. And I think one of the things that's really important from my perspective is I think that specifically around disability, that we need to get really clear in our heads the difference between impairment and disability. Because disability, the social model of disability is really useful here. Otherwise, you can conflate the barriers that people face. You can link them to some kind of something which is inherent within that person. And that's really, really dodgy. And I think I see a lot in the papers that I look at and the stuff that comes past me, where, somebody's done it earlier here, where they've gone, oh, they don't know how to use the technology. And somebody else has gone, no, that's our barrier, not theirs. It's really important that we put the barriers in the right place, because the lack of technology, the lack of accessible materials, so on and so forth, are results of or symptoms of actually not getting a good identification of what the barriers are in the first place. That takes me way back to the need for equality impact assessments on research methodology, on public involvement methodology, so that actually we're really getting people to think things through before they start. I kind of got involved in this discussion because I was passed some stuff to share across my networks, and I didn't want to do so because the materials weren't accessible, and I was going to get it in the neck from a few of the CEOs that I sometimes work with. And it struck me that an equalities impact assessment plus some guidance can kind of sort some of that stuff out and be some of the supports. But you have to get the equality impact assessment in. And there's something here about the First Lady, there's something about, we've not done this. Equality impact assessments, I think, came into place around 1988. And that's a long time to not do something. So I think that there's some looking at the underbelly, looking at the culture that needs to happen. Because if we're trying, there's this constant avoidance of doing this. And I think that's about a systemic discrimination that maybe we've yet to work to fully own. Let's be honest, to fully own. And that needs to happen. That work needs to happen. It's not going to happen with online equalities training. It really isn't. And the other thing is that when if you want to reach groups that you don't normally talk to, there's often a community group out there, or a local organisation of disabled people, or a local deaf club. These things cost money to run, and if you have in your PPI budget stuff which supports those guys for sharing their time with you, for sharing their expertise with you, these guys are your consultants, and they need to be equally valued and recognised as partners in this research, because they're the gatekeepers and the supporters to help you engage with the communities. So I think that shift in status, and that's really interesting because of the disability discrimination, because if you've got a bunch of people that you don't value, so you don't talk to them, it's quite hard to sort of like take a check and look at those people as your equals, and actually the people who are going to give you some knowledge. But you need to put the budget line in there. I think that's it, because I think I had 3 minutes.
Wow, that's amazing. Thank you, Tess. And Tess always picks me up on my incorrect language, which I do very often. I hold my hands up. I'm not very confident, and I don't know the language. And we will come back to that later.
Thank you.
It's one of our final, in fact, it's the final question, is around cultural barriers internally to involvement. So we'll get to come back to that in the panel. So thank you to the 3 of you there. We kind of need to run into our break, but I just wondered if Sally has anything from that she'd like to kind of summarise from.
Hi everyone. This is probably one of the busiest chat functions I've ever tried to keep track of, but there are some fascinating things coming up. There are specific questions for Josephine, which we can share with her later. And there's a whole bunch of things around the COVID pandemic being an opportunity as well as a challenge for public involvement. We've had a lot of suggestions for different platforms. usability suggestions, and also there's a bit of a yin and yang feeling to using online involvement and approaches for greater inclusion, and some nice examples in the chat feature of where it's been helpful and for other people it's been alienated. We've also had some really nice feedback on Anna's input, and Louca-Mai has you've shared your Twitter thread and also hashtag #CoProCovid, which is a good one to follow for some of the issues that speak to your contribution.
So everyone, we shall carry on. I've had my sip of water, I'm ready to roll. So I'm really looking forward to this next section. We have a load of great speakers coming up who are going to share some experiences, approaches and ideas about working with Black, Asian, minority and ethnic groups. Before we hand over to them, it's quite widely acknowledged, I think now, that the people that support public involvement are often from the white middle class group. And I just wanted to get a feel from the audience about where you feel that the setting that you either sit in terms of staff support or the kind of groups that you work with if you're a public member, in terms of whether you think the ethnicity of those groups are, I don't like to use the word representative, reflect the diversity of the people that your research is kind of meant to be targeting, or the local population. So another poll question. Reflecting on the diversity of those involved in your setting, do you think they reflect the ethnic diversity of the local population or target population for that research? So you've got yes completely, yes to some extent, no, unsure, or not applicable again. So see lots of votes coming through. And if you are someone that can't see the poll, it would be really handy if you could put in the chat what sort of device you're using and whether you're using a browser or an app or things, because it is really helpful for us to look into that and know that, because, you know, we're learning, like as someone said earlier, we learn as we go. So, right, I'm just going to give you 5 more seconds and I'm going to end this one. So, here we go, we'll share these with you. So, majority of people say no, it doesn't reflect, but we have a good percentage as well that is saying there is some extent of representation. Sorry, I keep trying to not use that word and then using it. We come on to again, like we said, we're coming on to things like language in the panel session later. So what I'm going to do now is hand straight over to Julian, who is a diversity and inclusion, equality, consultant at the Centre for BME Health, which is based at the University of Leicester. And he is going to tell us more about the work that they are doing there. So thank you. Over to you.
Thank you, Caroline. Thank you, everybody. Nice to meet everybody, our screens and what have you. Just a little caveat. I'm going to be reading this out because my mental illness is particularly bad at the minute, so I'm sort of struggling a little bit with memory. So if my eyes are gazing down, that will be why. So I think the first thing that I'd like to say really is that irrespective of whether you're doing face-to-face work or you're working in the virtual world, I think the starting point we try and do at the Centre for BME Health is to flip the coin when it comes to this phrase hard to reach, which is often used to in relation to underrepresented groups. But we actually prefer, I actually certainly prefer the term easy to ignore with regard to people in that bracket, because it's more truthful and accurate. You know, the people who are hard to reach tend to be at the tops of organisations. And even if I wanted to, I don't think I could sort of pop into Buckingham Palace and ask for a cup of tea with the Queen. She's particularly hard to reach and she's behind lots of other things. So it's a flipping the coin over, really. That's the sort of centerpiece for that approach. I want to talk very briefly about 3 things. Firstly is training. Secondly, and thanks very much to Tess for raising this, equality impact assessments, which I think are really useful and really necessary. And lastly, with regard to awareness raising when it comes to research. And I think with regard to training, I think it's fair to say that our training approach depends very much on face-to-face interaction. And that stuff that we do, the in-depth stuff, the lengthy, sometimes the unpredictable nature of conversations, the way conversations can veer off in all sorts of directions, and obviously people being able to sort of say things in that type of Chatham House rules environment that you know, is they can't possibly say in other sorts of places. So it also acknowledges, I guess, that for some people with disability and other reasons, that there is a problem with virtual technology. I, for one, with my mental illnesses, find it quite difficult and quite an intense experience. And so I think with training, you know, that can be really problematic, especially given the fact that our training tends to be day long. So there's quite a lot in it. I know a couple of people, Caroline, you included, have been on some of our training. That all being said, we've recently been working on adapting our Black, Asian, Minority, Ethnic, Engaging with BAME Communities Toolkit to the world of virtual reality. And even though it can't actually be a sort of a replacement for face-to-face stuff, we're actually we've produced a film that looks at some of the issues in that toolkit, that puts positive messages through, quite succinct film with members of the community talking about it, members of the communities raising various issues and so on. And then we'll be using the toolkit as well to produce an online training resource which fits that bracket and obviously also fits the circumstances of outbreaks, pandemics like today, like at the current time. Now, equality impact assessments, great subject, great topic, really important stuff. And I guess if you've been working, I worked in local government for 15 years, and equality impact assessments were a cornerstone of our equalities approach. You know, that they seem to have been here for a long period of time, as Tess rightly mentioned. And I think they are a really key process in terms of the way we go forward. So we have now at the Centre for BAME, we've instigated an EIA approach to all new art studies in our region, in the East Midlands. Study teams are therefore required to do a little bit of training and then an assessment as part of the initial application process. And it's actually a mandatory requirement. They have to do it as part of their application process for research. They then have to provide progress reports, and they have a team involving myself and 2 other colleagues available to them for advice and guidance as they go through that process. So in many ways, as far as health research is concerned, I think it's quite a new way of thinking for those involved in such research. And I think people have said so actually in some of the feedback that we've had, that this is a new approach. They're not used to it. It takes time to bed down, but really it is something that's going to be there for the future, and rightly so. Obviously, we've had to adapt our impact assessment approach to the current pandemic, because obviously we had to realise that work goes on when and whenever possible. So as such, we've been providing virtual sessions, service-based both on email correspondence, but also on Zoom sessions in which our team can discuss individual EIA submissions and then involve study leads in feedback, conversations on specific issues. So it's an ongoing dialogue as they go through the process of doing their work. So in that sort of sense, an equality impact assessment isn't just a document that you do right at the start and hope that things are right from the onset. It's a live document. It continues through your process, through your work, through your research, and is evaluated and modified accordingly. Lastly, because I'm aware obviously of time restrictions, I just want to say a word about awareness raising. The need for research, I think, obviously to reflect the entirety and diversity of communities. It's not just a legal thing. It is embraced in the Equality Act 2010. It's also much needed development. And we're very much aware at the Centre of the fact that at the moment, generally speaking, research does not really effectively include many marginalised groups, people from BAME communities, other protected characteristic groups, and so on. So in order for this to change, we need to be focusing on this much more acutely and certainly more thoroughly. And it's fundamentally part of institutional barriers and the underlying systemic discrimination, which obviously is very topical at the moment. However, it's also an immediate issue, because given what we know about the disproportionate impact of COVID-19 on BME communities and BME people, we have therefore been working on delivering key messages into BAME communities using video. And this includes translating stuff into community languages. It also includes involving people from local communities, delivering those messages themselves. And also we've managed to recruit sort of international people, including Omid Jalili, Whoopi Goldberg and Sanjeev Bhaskar as well, to actually put these messages across. So that's been quite useful, and it's received a bit of publicity. So by using film with appropriate messengers, and making effective use of social media, I think we stand a better chance of making a difference here. But obviously we need to continue that into the short, middle and long term. I think I'll stop there, because obviously I've probably approached you with 5 minutes and probably gone over, and then obviously I'll leave it up to my colleagues to take it on further.
Thank you very much, Julian. And we don't have time for questions now, but again, put them in the chat and we might be able to come back to them during the panel. So I'm going to move swiftly on to Meerat, who works for NHR Applied Research Collaboration, which is the ARC acronym that's quite come up a few times. And she's over at Northwest London. I'm sure she'll correct me if I'm wrong.
Yep, correct, Northwest London.
Great. You just your screen hasn't come up as, your PowerPoint's up, but not as full screened yet.
Yeah, just bear with me.
Otherwise, you're pretty much ready to roll. Thank you very much.
Okay, full screen. Great. Okay, so I am going to talk to you about an initiative called Community Voices, which is something that's working across Northwest London. It started soon after lockdown as a rapid response to COVID and everything that was going on. And I'm going to talk to you about the whole process, not just the findings, because in order to understand how we work with different communities, the whole process has been really relevant to how that's happened in practice. And so there's learning from all aspects of the process. So the background which has been touched on is that we know that health inequalities have worsened for lots of different communities, including Black communities and Bangladeshi communities, and also for disabled people. So for many of us, this has gone on throughout our professional careers. We're not hearing that we've made any changes on those issues. And then when COVID happened, obviously, expectedly perhaps, the same issues started to come up again. We started to hear that actually COVID was impacting BAME communities, specifically Black communities and Bangladeshi communities again, more than other people. So Community Voices is a way of trying to change this narrative, trying to understand how we work differently with our communities. So our approach is to hear people's experiences of COVID, hear what matters to them in their own words and through their preferred formats. Now, for some of you, you might be thinking, hang on, that's just absolutely normal. But for those of us who work in health research organisations, this isn't our norm. We normally go out knowing or thinking we know a question that we need to answer. So this is, for us, a new way of working. So Community Voices works because it is a collective. It's a collaborative of lots of different organisations across Northwest London. These are people in statutory organisations such as local authorities, CCGs, us at the Applied Research Collaboration, but also people from community organisations who are at the forefront of their communities and have built up lots of trust and strong relationships in their communities. And crucially, within the collective, a lot of us represent people who are most at risk and the communities who are most at risk. So we're not talking about these communities, we are part of these communities. So the relationships really come from people being based geographically within these communities and within the professional networks that we have as well. So we're capturing these stories and then we're rapidly feeding back findings. So we are assessing what people have said and we're feeding things back to them as well, and in sense checking with our communities that what they're telling us is what we've understood. And this also helps us collect further data. It helps us understand the things that we don't really fully understand but we think are issues that we need to uncover a bit more. And it helps communities kind of say, actually, you're not hearing from my story and from my experience. I want to share my experience with you as well. So far, within a relatively short space of time, we collected almost 50 stories. And these are from people who our organisations tend to term hard to reach, which and through this we've kind of shown that actually these people aren't hard to reach, but just as Tess said earlier, our existing structures don't necessarily include these people and don't really work for them in a way that they want it to work. So within this whole initiative, there's been a growing interest, not just amongst our community and more people want to be part of the collective, but there's also been growing interest amongst national organisations who see the model as a useful way of working. But for those of us in this field, again, this model isn't new. all we're doing is working together more collaboratively as organisations and not having such a set agenda. So going to the findings, I will not go into these in any depth now, just because I will not be able to do justice to what people have told us. But there has been 6 key findings. One is that people are saying that they're still experiencing the impact of racism and inequalities, not just in how they're accessing healthcare, but also just generally in society. People are really feeling like they're underserved. We're also hearing that we need to improve in the NHS and in health research our communication with people and communities. There's a need to rapidly rebuild trust, and some people are saying that the trust was never there in the first place. There's a need to acknowledge people are adjusting to a new way of living, working and schooling, and that really impacts people in different ways and in unequal ways as well. And what's come out quite clearly is that the role of communities in not just acknowledging the issues, but also being part of the solutions. There are amazing communities out there who are helping other minority communities and are at the forefront of providing services which aren't being provided by anyone else. And we need to really learn from people like that and models like that, rather than assuming that we can do it ourselves within our own organisations. Obviously, and I think this has come out quite strongly, there has been an impact on mental well-being. And again, this plays into the inequalities issues in terms of how people can address these and how they're able to, especially for people who are living in flats, like a lot of people in our patch in London are. And then there's also something that we need to really expand on more and really understand a bit more, which is the role of and the impact of faith and cultural practices on people as a coping mechanism, but also in terms of how COVID has impacted their ability to practice their faiths and cultural practices. So I am almost done, but collective action is really essentially what we're going to be looking at in phase 2 of this. How then do we hear these narratives, and how do we ensure that it leads to change across North West London in how we commission and fund community-based solutions to tackle health inequalities? We've seen amazing things that these people do, but we really need to now change the narrative and not hear this again in another 10 years' time. We need to therefore look at how we start working with communities to understand what can be done better. So our ask from you is consider replicating this model in your area, gather stories to initiate change, and work with your communities to find solutions. But also share with us case studies that you may have of large-scale change where people from underserved communities have managed to elicit change and improve the situation in a geographical patch. And that's it for me. Thank you.
Thank you so much. There's so much information there. I look forward to kind of staying up to date with how it's all going and trying to see if we can do something similar down in Wessex. So is Grace, are you around? You should be able to turn your video and your microphone on now.
Yes, I'm here. Hi, Caroline.
Hello.
Hiya.
So, thank you for joining us. So Grace is a public member who works with the public programmes team at the University of Manchester. So I always think it's really important and really valuable to hear from public members about your insights and your experiences. So thank you for joining us. What would you like the audience here today to know?
Well, thank you for inviting myself. I think a lot of my input really today is just going to give a bit of feedback in terms of what has been going well as far as my involvement with Manchester CRF over the last couple of years, and getting different levels of involvement. For myself, I've incorporated and worked, I've been involved with public health research, starting my journey from the informatics, working with Manchester University, and helped set up a team of PPIs called the Happy Team, and that was helping to integrate a different view and public relationship with researchers around obviously data science. But that then progressed on to working with Bella and Suzanne on the publics programme team in Manchester from the clinical research side of things. And for myself, what I feel has been successful, it's been seen as a valued member of the team, and having my input both at a strategic point of view, because I also sit on the executive team, and as part of that group and forum to look at things from an organisational perspective, but also work quite closely with Bella and the rest of the team, subject to whatever projects needed, both from, we have a group that focus specifically on the BAME community called BRAG, which is the group that looks at the BAME community across Greater Manchester, including people who come under the title of asylum seekers and researchers. And it's set up as an advisory group that works in partnership with the Publics Programme team. I also chair a involvement and engagement forum where we look at patients' experience across their different intersections within the hospital, and looking to elevate a better experience from start to finish. And I also work from a strategic point of view with Bella and the rest of the management team, looking how best the Publics Programme team can incorporate members of the public. And during COVID, for ourselves, I agree with some of the comments that's gone earlier. It has to some degree created a barrier, both from not my own personal point of view, but also members of the BRAG team, whereby sometimes people prefer direct contact around the table and seeing people, but it's also affected people from a mental point of view because of some of the narrative that's gone on, especially in the early days of the pandemic, both for what our government and other international governments the BAME communities. But what I've done outside of working with health research, one of the comments I'd made earlier in the comments box was around, for me, it's very much how inclusive any organisation wants to be. It's from the offset of how they incorporate from a financial point of view their resource to be able to make things as accessible as possible. And to do that, for myself, what we've looked at is to ensure that all participants, particularly for BRAG, are able to and were able to engage and still communicate inside the COVID pandemic. Everybody had access to data in order to jump on board all some of these fantastic technological platforms, but they're not easily accessible because they also can run up a lot of money. And also from the point of view that for those who were participating, they had access to the hard resource such as laptops. And that's a key thing that we've tried to ensure happens, to make sure the day-to-day business still gets looked at, but also within the period of COVID-19. But outside of that, for me, a lot of the things, and one of the comments I made earlier, I hope that organisations do see this particular period of events in 2020 as an opportunity to stop, reassess what your true vision and aspirations are to achieve equality and inclusion amongst your population, and that be redefined by it worked alongside a realistic framework that incorporates resources. And that's also from a financial point of view, from the highest level of discussion and business output to the more ground-facing work that's required.
Brilliant, thank you. And I'm sure there'll be some questions for you, which again, people, if they could put them in the chat, and then we might be able to come back to some of them during the panel session. So thank you for the speakers from that session. We have one more speaker now, and then we're going to take another little break before we move into the panel. So I did have another poll question for you, but I'm going to skip it. But if anybody has, one of the things that registrations brought up as a topic was more interesting, not necessarily saying these are uninteresting, but something different to just hosting a virtual PPI meeting as a novel approach to reach new audiences. So if anyone has ideas or things they've tried, please put them in the chat. And I'm really excited to introduce Sophia, who has done an amazing piece of work. She's the director of the Parenting Science Gang, which I think is just an incredible initiative. And it was all actually done pre-COVID. But little did she know how useful these learnings were going to be to all of us today. So I'll hand over to her now.
Hello everyone. My name's Sophia Collins, and I ran a project called Parenting Science Gang. I'm very honoured and excited to be here today with all these fantastic speakers, and I'm learning a lot. So I'll tell you a little bit about Parenting Science Gang. We ran it over 2 years. We worked with 8 different groups of parents. All of these parenting groups were online on Facebook. They were like existing Facebook groups. And we went into sort of partnership with each of these groups. And each of those groups went through a process of deciding what question they wanted a scientific answer to, what questions they had as parents that science wasn't serving them yet. And then they went through a process of designing and running their own experiment to answer those questions, often in collaboration with scientists. Out of those 8 projects, out of those 8 research projects, several of them have now led to scientific papers. And the kind of research that they did ranged from, on the one hand, one group were really interested in the composition of breast milk for older children. So we had 135 breastfeeding mothers come to Charing Cross Hospital in London and donate some breast milk, and it all got put through a mass spectrometer. And then at the other kind of end of the scale, another quite different sort of research, larger mums with a high BMI had issues about their experiences during pregnancy and birth. So the group did sort of social research, social science research with those mothers and interviewed them, and then did kind of textual analysis to pull out themes of like what those people's experiences of interacting with healthcare had been. So it was a real kind of range of things that the practicalities of, I mean, I can't, it took 2 years. I can't cover all of it in the next kind of 2 minutes or whatever I've got there. But it mainly took place on Facebook. We created groups, and lots of the conversation took place in those groups. Facebook, whatever you think of their kind of ethics and what have you, have done a really good job of working out how to have like lots and lots of people interacting with each other online. You know, they've spent however long they've existed trying to get that right, you know, and it's very easy to communicate on Facebook. 79% of online adults in the UK are on Facebook. It's the most commonly used social media platform. It's where people spend the majority of people's kind of clicks on the internet, and the majority of people's time spent on the internet. More is spent on Facebook than anywhere else. So that's why we were doing it on Facebook. And that's where people, a lot of people, when they become a parent for the first time, they find themselves in Facebook groups, and that's where they're doing their kind of looking for support and advice, and they're asking questions at 3 o'clock in the morning because you can't talk to your health visitor then, you know. So we did it in these Facebook groups, and conversation can be threaded, you can run polls, it's very easy to kind of ask people, to get lots of input. We asked people for like all their suggestions of questions, we thrashed them out, and then we arranged online Q&As with various different experts. So the mums in these groups, it was open to parents, but it was overwhelmingly women who joined. Make of that what you will. But the mums in those groups, we arranged for them to have online conversations with experts, and these ranged from sort of people who studied infant sleep, to people who designed questionnaires, to people who, you know, did mass spectrometry, to anyone they wanted to talk to, and they could ask them all the questions that they wanted, and then they kind of went away and took all that into their thinking about what questions they had and how they could investigate them. And that's what we did. I think I've covered everything I was intending to cover. Oh, one last thing I wanted to say. Can you see that? Right, hang on. I thought this was easier than faffing about with trying to share the screen and then unshare the screen and stuff. I'm holding up a piece of paper. For those of you who don't have visual, you don't make, hang on, what do I say? Film by filming a play from the best seat in the house. If you're thinking about adapting your existing activities that have been done offline onto an online thing, don't just think this is exactly how we do it in the real world. You know, how can we replicate that exactly? You know, we don't always need to be Zoom meetings and stuff, you know. Online has its own, what's the word? There's these things you can do online that you can't do anywhere else. And there's many advantages to online. There's some disadvantages, but it's easy for people to kind of dip in and out online, but people can, we found we had like ongoing long relationships with people. You know, there's benefits in like, you don't have to worry about parking and toilets and food, or people have sorted that stuff out themselves because they're in their own homes, you know. So there are disadvantages to online, but there are a lot of advantages, particularly for different groups. So there we go. If you've got questions,
yeah,
I think I've finished. I've got some links, I'll put them in the chat.
Put the questions in the chat, and I think my team have shared some of the blogs that we found most, you know, really inspiring from the Parenting Science Gang website, because they are really, really, really useful. I can't say that enough. So thank you so much, Sophia. Right, so we shall move on to the panel session, but so kind of Josephine, trying to work out who's missing. Grace, Bella, Louca-Mai, maybe welcome to put your cameras back on. I know Bella had something to add, which sort of ties into both what Josephine said and what Sophia has been talking about the novel methods. So I'll let her speak first.
So hi everyone. I'm only going to say a few words, but I thought it might be interesting just to say a few things. Where I would start. So my name is Bella. I'm based up in Manchester, as some of you will have heard already, in the northwest of England. And reaching new audiences has always been something that we've been really quite creative about, I hope. I mean, I think as a sector, as people who are involved in research, you know, we are quite a creative community generally, and I think this is a, you know, kind of ideal opportunity to build on some of that creativity that exists within our communities. So we've been trying to kind of work on an approach that both kind of capitalizes on reaching new audiences through some of our kind of awareness raising activities and engagement work, and brings that together with the really in-depth and influential aspects of patient involvement, so influencing the research that is done so that it is more relevant and inclusive of those who might stand to benefit the most from research. So we've published this approach, and on the screen now you can see a link to that paper, and I will draw on some of the elements of that paper in just a couple of the things that I'm going to talk about now. It's interesting reading the chat and some of the things that have come up already in the chat. One of the things that we do to reach new audiences and to, I suppose, level the power relationships between those who might be less well listened to in research and those who hold the power in research, so the researchers and funders, etc., is to work with a lot of arts-based approaches or creative approaches or different approaches that can help to a degree, level some of those playing fields. And it's interesting to see in the chat lots of creative projects that are being referred to already. And also there was a question in the chat about intersectionality and dealing with, you know, kind of multiple differences that we all have with each other, and sometimes some of those boundary approaches, those approaches that blur the lines between identities, can be really helpful in terms of thinking about intersectionality. I'm going to talk about really briefly about two projects that we're doing, and I think they relate back also to some of what Josephine was saying in terms of global health research. And in the move to doing a lot of online methodologies and thinking differently about public involvement and how we reach new audiences, I think one of the things that is an opportunity is that we now have the potential to reach global audiences through doing things online. And just the sheer number of people who are on this call or on this Zoom meeting is testament to the fact that, you know, we can really reach a lot of people. One of the things that we're doing at the moment is creating a comic, a graphic novel with young adults called Planet Divock 91, which is about this, it's loosely based on this pandemic that we're in, but brings in the voices of some of those people that we believe probably haven't been included in the debates around COVID-19 and pandemic research as much as they might have been. So we're building on our approach by introducing a creative element whereby young adults, researchers and artists are co-creating a comic based on pandemics research. And so lots of young artists interview scientists, and then the creatives work together to produce a comic that is going to go out on a global platform, which is particularly aimed at young adults, but has quite a diverse readership. So we know that it reaches about 55 million people globally, but that many of that readership are from, you know, kind of communities and, you know, kind of characteristics that are less well listened to in research. And what we're going to do throughout the whole process is capture the themes that are coming from the co-production process, as well as some of the themes that we're going to capture online through people who comment on the comic, people who read the comic and that kind of thing. And hopefully we will then feed those into research and policy audiences in terms of then being able to bring the perspectives and views of those young adults into priorities and the design and delivery of pandemic research. And you know, we're launching that on the 15th of July, so watch this space. I'd be really glad to hear your comments and see how it goes down. Obviously, this is on the basis of people being able to engage through smartphones. And we've done some research. Our work is going to be carried out primarily in the UK, South Africa and India. And we know that a lot of people use smartphones in those areas. So we've specifically adapted the project's design so that it is inclusive of and targeted at those people who use smartphones. Now, of course, the corollary to that is that not everyone reaches smartphones or uses smartphones. And I just wanted to reference another project that we're doing, which is in sub-Saharan Africa and the UK, looking at creative engagement between immunisation and herd immunity, and again, following the approach that we've outlined in our paper. We've really had to adapt this project because a lot of the engagement and involvement that was happening in this project was reliant on face-to-face interactions. So as others have presented and talked about, we're now moving a lot of our engagement onto Facebook Messenger, onto WhatsApp, onto telephones. Now, this is, whilst a lot of people might not have access to smartphones in sub-Saharan Africa, actually they do usually have access to a telephone handset, mobile handset of some description. So we're really trying to think about how we can use that technology appropriately in the context. And this isn't just focusing on young people, but we're also targeting church leaders, older groups, and some who are perhaps perceived to be at the margins of society within sub-Saharan Africa. We're trying all this. It's a bit of an experiment. Hope to report back about it very soon. But just to say in closing that we're trying everything that we can to make that accessible. So we're providing data bundles. We're providing things like essential items like face masks so that the engagement can go ahead with as much support as we can possibly do. And I know that's a challenge, and it's often a very difficult challenge with funders and finding the resources to make all those supporting activities happen, but we hope to report back on it soon. So I'm going to leave it there. I'd love to, kind of comment on some of the other things that have been raised in the chat, but I think for the time being, I should hand back to Caroline.
Thank you. So I'm actually going to hand over to Sally, because she's been the chat moderator with. So
thanks very much, Caroline. So some of you have been asking what will happen to all of the chat content, because it is an absolute treasure trove of comments, views, but also links and follow-ups. And I think there's something for the organising team to do with that. And Isla suggested that we could think about theming it together before we shared it more widely. And with that point in mind, I have done a couple of themes from this second section of the session. And then I have one question that I'd like to ask the panel or the people that have spoken so far. So just to run through some of the themes, and I'll try and name check the people that brought these up as I go through. The first one was around equality impact assessments, or EIAs, and there's also been a plea from people, can we stop using three-letter acronyms in our work, because they are a barrier for many people. So equality impact assessments, so a lot of chat about those, and also in combination with those, and whether we use them and how we use them, but also the sort of element of data collection and coverage which you get with that sort of process. So that was one theme of discussion on the chat function. Another one was around payment and funding, and Nat Day suggested that we should be thinking about funding allocation to community groups if we're going to be more inclusive, because that's where a lot of what people have been speaking about today has been happening within the communities. And we should be making sure that as researchers we're engaging with the community groups in the applications for funding, but wouldn't it be nice if they got funding anyway? And Grace, who we heard from just a minute ago, said it's a real, it shows that we need more commitment to financial frameworks that support research projects. If we don't do that, we'll always keep those barriers up. Another theme of chat was using phone-based platforms. Roni, Isla, Michelle have all talked about using WhatsApp on phones, and actually Meerat just made a comment that sometimes we can learn from our research partners because some of them have to use this tech and are more savvy at it than we are, as in people that involve others in research. There's also been a little huddle of comments about critiquing the language that we've used. So we've had hard to reach and seldom heard. And Amna Raman said this usually equates to being ignored or avoided, which I thought was interesting. And perhaps Sonia and Eleni say perhaps we could, Sonia says perhaps we can just find a language that avoids the negative connotations. And underserved was a phrase that several people have used in this session. There was a suggestion that we could maybe move to a universal language. There was some pushback against that. Eleni said, we'll never manage that because we're all different and we have the right to define ourselves. Having said that, Philip Hammond said that perhaps we should think about looking at a universal language because of the backlash against generic terms like BAME, LGBTQ+, etc. And then the final sort of area where there's been some discussion is around models of working for improved inclusion, and something about community development models, community participatory routes were mentioned by Mo, and Bridget York was suggesting that we should be improving the ways that we get feedback from different groups and people, and sometimes that patient surveys are not asking the right questions on outcomes, they're not looking for adverse events, and there are poor structures for investigating poor outcomes for some groups. So that's a feel for some of the comments, and I guess the question back to the organising team is, how do we present all this rich information in a way that is helpful to people who've clearly come on this session today because they've felt the need to learn more and share more. So I have a question for the speakers, and it's a pretty big question, and it is from Savi Hensman, who says, how can we address the pressures and culture shaping research which discourages addressing the socioeconomic inequalities affecting health and care and thus research? So I'll just repeat the question for our panel members. How can we address the pressures and culture shaping research which discourage addressing socioeconomic inequalities which affect health and care and thus research? And I'm just wondering who would, from our many speakers, would like to give a response to that? And just remember, you'll need to unmute yourself when you do. Perhaps they can show me that they want to respond to that question. Meerat, you want to go first, and then we'll go to Josephine?
Yeah.
Okay, Meerat first, then Josephine. Thanks, Meerat.
Okay. Yeah, I hear this. I know that this is a frustration that a lot of us who work within academic institutions are really struggling with and grappling with, and what we're doing doesn't seem to work. So there are, just in terms of academia, there are examples of really good success stories of models that work for this. For example, is the Birmingham City University Black Studies course, where as part of an undergraduate degree, everybody is required to take part in social change initiatives within the community, and all undergrads are go out into the community and work within the community. So while it's not health and care, it's interesting that there are examples in other parts of academia, and I think it is really about learning from that and bringing those back into our funding structures and the NIHR structures and the National Institute of Health Research structures to highlight that this can actually work.
Thanks very much, Meerat. Josephine, did you want to respond to the question?
Yeah, I think that it may not be a fully comprehensive response, but it's kind of something from my standpoint, and it's the feeling that research institutions are still ivory towers. And that means for me that they're not representative of diverse communities on the ground, and research is still very top down rather than bottom up. And there are funding drivers, but the key thing for me is that we need a broader diversity of people conducting research, so we get some of the drivers to pick up on the issues that are most impacting local communities. At the moment, there's a real issue about who benefits from the research. I am currently involved in research groups where the participants feeding in and who have been recruited don't represent the people who are most being affected by the issues. And that means that our research findings don't reflect the groups that most need to benefit from that research. And it's a wide-ranging, pervasive issue. So for me, and I tried to pick this up in my presentation, and it's complex. I think we're at the start of a journey, but I really hope, in the way that I've seen reflected on Twitter, that people speak out really, really loudly on this, because I think it's actually gone on too long. And I think particularly when we're talking about the pandemic causing groups who are already disadvantaged to die in very large numbers, we have got to make more of a stand in saying diverse members of the public need to be involved as co-producers, not just feeding in where they get no recognition and they're really just treated as objects for, you know, academic institutions who benefit, or for people, you know, feeding into people's careers. So that's one thing, the research participant side. But then I think that people from diverse communities need to be allowed to have a leadership position. And we're going to really have to address this. Otherwise, we are still going to be perpetuating neo-colonial approaches. You know, the BAME people and from other disadvantaged groups, so the intersectionality, there have to be leaders on the research so that they can try and reproduce some of that research from the perspectives of diverse groups.
Thanks very much, Josephine. I think Tess wants to respond to this. Tess, are you available and unmuted? And then I think
I'm available and unmuted.
Fabulous. Off you go.
I started to type it. I think that I'm blown away by my predecessor. She's kind of spot on there. I've been asking for 7 or 8 years. Because I got involved because my mother was used as an object of research, for grant board meetings to be co-chaired by a PPI member. Now, Caroline's group, we do this at the reference group for PPI, but they're very particular things. If I've been asking for 7 years for grant board meetings to have a PPI co-chair, why hasn't that happened? And I think that we've got all of the things that Joe's saying, but actually we've got to go right back, and we've got to sit down in rooms with people, with medical students, before they even go out and mess in the community with paradigms which actually might be quite damaging, because they've probably been educated in a bit of an ivory tower, and that's an assumption, so please do forgive me for that, but these are broad strokes. We have to do the work, and the work will take money. I want to talk to medical students. And I want people who work from my industry to talk to medical students, not as a freebie day out for a cup of tea and a biscuit. They're experts, and it's that. And I don't know, I'm in a room, I'm probably talking, I always feel sorry for Caroline Barker because I'm always ranting at the very much converted. So sorry, Caroline, but that's what we have to do. So all the other stuff that's sort of listed along the sides about the groups and the networking, all of that is fundamentally important, but it is not underpinned by us going, actually, there is discrimination, this is systematic discrimination, and we're not somebody died a couple of weeks ago, because some was school, probably to let the kids, somebody died because a police officer put their foot on somebody's neck and they killed them, right? The police is an institution in this country, it's a publicly funded institution. When it does violent things to people of colour and disabled people, with people of colour, at least we're getting some response now. When the police do violent things to disabled people, it don't really get mentioned that much. But you generally work for public bodies. You have the same public sector duty. This is really, really serious. People die because we kind of make assumptions about what disabled people want, or what black people want, or about, like, my family's Irish, so for the people from the Gaeltacht don't have written English in the UK, and they're all hitting pension age and they're very confused.
Okay, Tess, thank you very much for feeding in. I'm
Sorry,
just looking, no, it's fine. Caroline, have we got time for one more, or are we at the end of the session? I just need some direction from you on that.
So I'm happy to continue with everyone else. I'm really sorry the people that do have to leave, but we are still recording. So
okay,
I'm happy to carry on if others are, but I know that's naughty to overrun our time, and that annoys a lot of people.
So we might be a bit naughty, and we're just going to allow Bella to give us she's promised some concrete examples of how to address the original question, and then I think we'll draw the session to a close. So Bella, over to you, but if you can keep it to like 2 or 3 minutes, that would be good, please.
Okay, I'll really try. This has been an amazing discussion. So I think I totally agree with what Josephine and Tess have said. You know, absolutely yes to all that's been said. I think there's a few things that we can try to do both at a local level and a national level. So what we're trying to do, we've set up a health inequalities steering group who within our research infrastructure, and the aim of that group is specifically to influence our senior management to change the way of doing things and to make the research that is carried out more relevant to the people that it stands to benefit. And that group is composed of public contributors, people like myself, people like Grace, and also like-minded researchers who are as appalled, some by the situation as we are, and really want to see things change. And we think we're beginning to have some traction. So I'm happy to talk to anyone about how we've set that up and how if there's anything that could be of use to other people. The other thing is demographic data. So again, it's come up on the chat, but there's a really real dearth of data about, well, we know that we're excluding lots of people in our research, and it's not even national policy to have information and data about the people we are including and are excluding, and that really needs to be changed at a national level. And then I think I only saw it last week, late last week, but the NIHR have put out a call. Well, there is a job being recruited for the head of diversity and inclusion at NIHR, and that is going to be a crucial role and absolutely needs to have someone in it speaking from experience and authenticity, who can really make a change to the NIHR that way.
Okay, thank you, Bella.
And
Are there any other panel members or speakers who want to squeeze in a few seconds for those that are still on the call? We've still got a lot of people here who haven't had to rush off for other Zoom meetings. So if there's any other speaker or panel member...
Julian's got his hand up.
I thought he might. Okay, okay, Julian, off you go.
Yeah, the danger with speaking sort of fifth in line is that everything that everybody said beforehand is covered, if you like, in what I'm saying. I totally agree with that. I've just put something on the chat, which was really about, you know, what we're talking about here are these sort of systemic discrimination, these pervasive institutional barriers, this institutional discrimination that we've been hearing about for years, for decades and so forth. And we have to use that opportunity now to really get to grips with this. That has to be fundamental. And I think, you know, the Black Lives Matters, the Disabled Lives Matters, you know, all these things really, really need to be brought into perspective and to be used as a new push. The other thing I would just say with regard to the original question, I forgot exactly what it was now, but talking about the push for these sorts of things, the rationale, that's very much the rationale for why we've instigated equality impact assessments in the way we do, and why we've made the process pervasive all the way through it, so that people do have to think about these things and they're accountable for it as well.
I'm just going to shove a poll up because the numbers are dropping fast. So I'm just going to see if we can get anyone to take part in this final quick evaluation poll. But I also want to say a huge thank you to all the speakers and to Sally, because I couldn't have, you know, we couldn't have run this event without them. And thanks also to Mike and Catherine, who are like silently working away in the admin of the Zoom chat behind the scenes. So thank you everybody for joining. Sorry we've overrun. We tried our best. Sorry the panel was also short, because I think that was really valuable, and it's a shame we didn't get more time to cover all of that, but all the speakers were so, you know, essential that it was difficult to cut anyone off, because all the information was so useful. So thank you so much everybody. I should be quiet now. Thanks as well to Tess and Grace for your contributions as well. It's great to hear from public members, as we said.